Titanium and castable extra-grade cylindrical abutments with passing holes for the screws. Titanium and castable extra-grade cylindrical abutments with an inclination of 15 degrees without screws. In case of marked divergencies between implants in the maxillary anterior region, you can use the extra-grade cylindrical titanium abutments or the castable ones, with an inclination of 15 degrees in order to obtain a good aesthetic result. Seeger bridge fixed prosthesis. Building a Seeger bridge fixed prosthesis, the divergence between the implants no longer represents a problem because it is used as an aid to obtain retention and stability for the prosthesis. Analyzing the divergence between the implants and planning the characteristics of the future prosthesis, you choose one or two lines of insertion towards the divergent implants, mounting the extra-grade cylindrical titanium abutments with an inclination of 15 degrees and their castable cover on the incisor OT equator analogues. In the small external pyramid, the facet indicates the direction of the extra-grade indented rim. By verifying the available space on the model, you can lower and adapt the height of the cylindrical titanium abutments and lower and adapt the height and incline the castable cover around the abutment. You should mount two extra-grade cylindrical titanium abutments with their screws and their cover on the OT equator attachments of the molar region. Once you have shaped the whole structure, you melt it using the common lost wax technique. You paste the titanium abutments without the screws on the melted bridge in the incisor region first, using anaerobic cement. After that, you paste the titanium abutments on the analogues in the molar region using anaerobic cement. Once you have positioned the screw inside the abutment, you apply some wax or a piece of a burr of 2.5 mm diameter in order to maintain the hole is completely cleaned and free of cement. To apply the finished bridge to the model, you need to follow the chosen insertion lines. Firstly, you insert the abutments onto the OT equator spheres on one side, keeping the prosthesis inclined towards the divergence. Then you press on the other side, making the cylindrical abutments rotate on the spheres, and the prosthesis snaps into position. Locking the screws onto the distal attachments, the incisor ones will also be secured in position thanks to the Seeger springs, assuring the stability of the prosthesis. In case it is necessary, you can remove the bridge by unscrewing the screws and following the reverse procedure. Divergences between incisor implants often represent a large problem. Using the extra-grade abutments without the screws, you can solve cases where divergences arrive at over 70 degrees. Having the OT equator biologic attachment screwed into the implants in the patient's mouth, all the intermediate trials and the final application of the prosthesis will be carried out by the dentist in a very short time. It is enough to remove the provisional prosthesis and apply the definitive one without any need to remove the abutments from the implants. Considering the 4 to 5 sessions between the taking of the impressions and the application of the prosthesis, work time is noticeably reduced. It is also important to consider that all these sessions do not cause any pain or trauma to the patient, with no need for an anesthesia. During the planning of the prosthesis, considering the high resistance of the Seegers, more than 7 kilograms, the dental technician can decide how to distribute them and the screws in order to assure the stability and the aesthetics and to help the dentist to apply and screw the prosthesis easily.